How to use the TouchBio 5in1 ADV, RSV, COVID-19 and Flu A and B rapid antigen combo test. These are the materials included in the kit. Step 1. Wash or clean your hands and make sure they are dry before starting the test. Step 2. Read the instructions for use carefully before using the test. Step 3. Carefully place the extraction tube into the tube holder or tube stand and remove the seal. Caution: do not drink the extraction buffer liquid. If you accidentally drink it, immediately consult a healthcare professional. Do not spill any of the extraction buffer liquid. If you spill it, sterilize the area and repeat the test by using a new sampling swab and extraction solution tube. Step 4. Pull open the swab packaging at the marked point and remove the swab. It is important to not touch the soft head of the swab. Do not open the swab until you are going to use it immediately. Step 5. Tilt your head back slightly by about 70 degrees and gently insert the swab about 2 cm into the left nostril, at least with the entire soft swab inside. Then, gently rotate the swab at least 5 times against the nasal wall. Do the same for the right nostril. Gently insert the swab about 2 cm at least with the entire soft swab inside. Then, gently rotate the swab at least 5 times against the nasal wall. Remove the swab from the second nostril. If you feel discomfort, stop immediately. If the swab stick breaks during the sample collection, please use a new swab. Do not insert the swab deeper if you feel strong resistance or pain. Step 6. Insert the sampled swab into the extraction buffer tube and dip the tip into the tube. Rotate the swab tip 10 times along the inner wall of the buffer tube and squeeze the tip of the swab 5 times along the inner wall of the tube to keep as much of the liquid as possible. Step 7. Remove the swab from the tube by squeezing the sides of the tube to release the liquid from the swab. Discard the swab in the biohazard specimen bag. If squeezing of the tube is not done correctly, the sample swab absorbs much more liquid from the extraction buffer and will yield wrong results. Step 8. Close the attached lid of the extraction buffer tube and then shake the extraction tube vigorously to mix the specimen and sample extraction buffer. Ensure the lid is properly closed and do not spill any of the sample extraction liquid. Step 9. Open the foil pouch, take out the test cassette and place it on a flat and clean surface. Perform the test within 15 minutes after the foil pouch is opened. Step 10. Add 3 drops of the extraction buffer tube into each of the 4 sample wells on the test cassette. Ensure that at least 3 drops of the liquid from the specimen tube are added to the sample well. If adding less than 3 drops, that will yield wrong result. Step 11. Set a timer and wait for 15 minutes. Read the result at 15-20 minutes. Do not read the result beforehand or after 20 minutes, even if a line has already appeared at the region marked C. Step 12. Please dispose all parts of the test kits and place them in the biohazard bag that can be disposed in the household waste or rubbish bin. If there are local regulations, please follow them. Step 13. Wash your hands thoroughly after test completion. Interpretation of results. There are 4 separate reading windows on the test cassette. The first window reads for influenza A and B, the second window reads for COVID-19. The third window screens for RSV, and the last window indicates ADV. Reading positive results. If 2 red lines are visible on both the control region C and the test region A in the first window, influenza A result is positive. If 2 red lines are visible on both the control region C and the test region B in the first window, influenza B result is positive. If all 3 C line, A line and B line are visible in the first window, influenza A and influenza B test results are positive and valid. For COVID-19, RSV and ADV, if both C and T line are visible, result is considered positive for COVID-19 and or RSV and or ADV. In rare cases, more than one virus may be present at the same time. This is called co-infection. If the control line C and more than one test line in either the T, A and or B region appear, this means you are positive for each virus indicated by a visible test line. Results should be considered as positive only for the virus against which lines appear. If you are infected to multiple viruses, then C line and T line will appear against each of that virus. The shade of lines may vary, but even if a faint weak line appears, it should be considered positive. If you test positive for COVID-19 or feel unwell and need advice, it's important to follow the guidance provided by the Department of Health and Aged Care. For more detailed information, please refer to What to Do If You Test Positive section in the IFU or our website. Reading negative results. If red lines appear in only the control region C, but no lines appear in the respective test region T and/or A and B, the result is considered negative for that specific virus. You are considered negative only to those viruses against which T line is missing, however C line appears. The negative result indicates that there are no any of these particles in the sample, or the number of viral particles is below the detectable range. Even if you get a negative result, you still need to follow all public health advice on limiting the spread COVID-19. If symptoms persist, repeat testing and consult a medical practitioner for follow-up clinical care. Reading invalid results. Results are considered invalid where T line is visible but no C line, or both C line and T line are not visible. Insufficient sample volume or incorrect procedural techniques are the most likely reasons for the control line C failure. Review the test procedure and repeat the test using a new test device. If invalid result continues after repeating, please contact TouchBio Technology on the provided contact number or email for assistance.